everyone. My name is Jesse Chason with Lisa Blanchard as the host of Airing Addiction.
I share often my journey started on this campus. Got sober as a client here, just like you.
I really do see phenomenal change.
Always hope. I've seen situations that on the surface look impossible, become possible.
Doing this podcast is to share those recovery stories, be honest about what the challenges are and have some real conversations, but kind of share that out on the airwaves.
Welcome everybody to another episode of Airing Addiction, where we talk about the realities of substance use, recovery, and the hope that gets us there. Longtime listeners to our podcast will be familiar with that golden thread of hope that we always talk about here. And today, our guests certainly contribute to that hope. Today, we're going to focus on how we support parents in recovery and healthy development of their children. And I will turn over to Lisa to introduce who we have today.
Thanks so much, Jesse. Yeah, thank you everybody for joining. I'm really excited about this episode. This is one of a few we've had recently, really focused on the kind of research side of the work that we do. And I think, and this is another kind of research opportunity that Spectrum has been taking part in. And we're really happy to be kind of contributing to the field and to what we learn about the field and how we can support people differently. And one of the things that we're really focused on is how do we not just support the individuals that we're working with in treatment, but how do we support the whole family system? And so that's really part of why I'm so excited about our work together and excited about this conversation today. So today we have Dr. Lili Peacock Chambers with us. She's the Chief of the Division of Health and Behavior in the Department of Healthcare Delivery and Population Sciences. Nice long title. She's also a board certified pediatrician and an associate professor of pediatrics and healthcare delivery and population sciences at UMass Chan-Baystate. So Lili does quite a bit of research, but she also, as a pediatrician, her clinical and research interests really focus on the promotion of optimal early childhood health and development among families facing adversity and marginalization, particularly those affected by substance use disorders. And this is part of why it's so exciting to have this conversation here today. And joining Dr. Peacock Chambers is Dr. Amanda Lowell, who's a licensed clinical psychologist, assistant professor at UMass Chan Medical School Baystate, and assistant professor adjunct at the Yale Child Study Center. So as a clinician, Dr. Lowell provides psychotherapy and parenting support to caregivers who've experienced complex trauma. We've had lots of conversations here on the podcast about trauma, those in recovery from addiction, and any caregiver working to break harmful intergenerational cycles. Her research is informed by practice and applies the science of attachment and evidence-based support. So we're really looking at a great opportunity here to hear from two real experts in the field that, as Jesse said, give us some hope and give us some understanding for what families are facing in this opioid crisis and in the space of addiction. So as we get started, Lili, would you like to just start us off with a little bit about kind of the trajectory of your career and how you landed here? And then I'd love to talk a little bit about kind of the research project that we are working on with you.
Yeah, absolutely. Thank you. And thank you so much, Jesse and Lisa, for having us. We're really excited to be here and talking with you today. So not to take it too far back, but I'll just say I have, when I first got into the field of public health and medicine in general, I was always interested in adolescents, and I worked a lot around HIV prevention, especially internationally. But as I became a pediatrician and did my pediatric training, I started to feel like, it's intervening in adolescence is a little late, let's go earlier. And so I got interested in kind of earlier and earlier childhood development to the point where I started to see those first 3 years of life as really a critical window of brain development, of attachment development, a lot of the patterns that are established throughout the life course. So when I began my research training, I was really focused on that early childhood period, as you mentioned, for families facing various kinds of adversity. And I was working in Boston at the time and really interested in working with Latino families and Spanish-speaking families, especially in the East Boston area. I then traveled across the state back to my roots where I grew up in Berkshire County. And I worked as a pediatrician there in a federally qualified health center for a year. And I think it was at that time where I was returning home and really seeing the impact that the opioid epidemic had had on the area where I grew up, whereas, 20, 30 years prior had not really been a major factor. And then I'm coming back as a professional working with families and learning about a lot of the different systems that support families there, and hearing from especially like early intervention folks saying like, we have in our caseloads 40 families in one agency alone of substance exposed newborns who get referred from the hospital, and we don't know what to do. Like, we're not trained for this. So that sort of fed my clinical interest. I ended up at Baystate in 2016, where I was fortunate to have the mentorship of Peter Friedman, our chief research officer at the time, and an addiction health services researcher. And so he really helped me to kind of bridge my interest with early childhood development with addiction health services research. And then in a very fortunate turn of events, I was introduced to Nancy Sookman, who was at the Yale Child Study Center and was a mentor for Amanda Lowell and myself, the developer of Mothering from the Inside Out. And I guess the rest is history from there. I'm sure we can get into Mothering from the Inside Out a little bit more, but I'll pause there and just say, a bit of luck, but also, different stepping stones connecting along the way.
And things happen as they should, right? In the order that they should, for sure. You see that time and time again. So Amanda, I'd love to hear kind of a similar kind of trajectory for you. Like, how did you get to this space?
Absolutely. And, I thought a lot about this kind of coming into this conversation of, what did get me here. And I think what gets us places and what keeps us places can sometimes be different. And so what got me here was I knew as early as being in high school that I was really interested in mental health and child mental health. And I knew really early that I wanted to be a psychologist. And so I said, okay, let's go do that. And so I went to school and had the fortune of doing some really early research. And my first research experiences were about attachment. And I was really interested in the concept of attachment as it relates to families who face different adversities and risks. And so really stayed in that space for a while. And then became really interested in kind of intervention and prevention. And in Orlando, Florida, which is where I grew up, I was still there for college and graduate school, became interested in working with the community, including child welfare involved families, and really struggled to get connected to the population of folks through direct involvement with child welfare. So we realized that coming in through more helping systems that are perceived as differently from child welfare could be another avenue to provide prevention support. And so instead of providing things through contracts with child welfare, we went into the local residential pregnant and parenting women's recovery program, and started providing a program called Circle of Security, which is a really fabulous, beautiful, attachment-oriented program or curriculum that facilitates conversations around what it's like to be a parent and what's hard in parenting, and the things that it taps into that are both beautiful and positive, but also really can tap dance on what we call ghosts in the nursery, and make parenting really challenging. And I really loved that intervention, but I thought to myself, there's so much, we could go so much deeper. And what about the specifics of being in recovery that are not touched in this really wonderful program, but are really unique and specific around the intersections of recovery and parenting? it just is such a unique kind of intersectional space. And that's how I became familiar with our late mentor, Dr. Nancy Sookman's work, who was doing exactly what I said, well, somebody doing this, and she was. And so as part of my training, I matched for my predoctoral internship and postdoctoral fellowship at Yale. And I didn't know if I would get to work with Nancy, but I sent her a cold email and said, "Hi, this is me. This is what I'm interested in." And she really took me under her wing. And I never looked back. And I've spent a lot of time kind of wondering about, just doing some self-reflection about, okay, I understand my trajectory and like, what is my why currently? I really have loved working with so many families and parents, particularly who carry lived experience. That's such a beautiful part about the recovery space that I really enjoy. And I think that the lived experience piece, while I don't carry lived experience of addiction of my own, something I've realized that I do tap into is lived experience of being a child of a parent in recovery, and using some of that to really inform my why, and the clinical work and the research work that happens.
That's so fantastic. And I think I loved how you started that, right? Like what gets you there and what keeps you there are two very different things. Like I probably shared a handful of times on this podcast that I actually never intended to enter into addiction work. I kind of landed there when the mental health clinic that I was working for kind of merged with Spectrum and the substance use programs. And so I really kind of blended a lot of that and then fell in love with the work and fell in love with what impact it has. And that kind of what's kept me here for now, 27 years. I was 12 when I started, for sure.
Yeah, Lisa had a high school agreement working out when she started.
Yeah. But I think that and I think the other thing that I really appreciate, aside from like your really fantastic experience, really starting right in a women's recovery home and starting to try to apply some of these concepts, is that idea that there's lots of different kinds of lived experience. And we all bring that to our work. And I think that is really helpful. I also say, like, I don't have lived experience in addiction and recovery, but I often surround myself and really spend a lot of time immersing myself with those that do and listening to that voice of lived experience. And that really informs my practice and the work that we do. So it's so great to hear kind of how you both kind of, traveled and landed, in a similar spot. So I think this would be a great opportunity to talk a little bit more about what mothering from the inside out is, and how is it applied. I don't know who wants to get us started on the description of the model, but I'd love to hear more.
I think that's an Amanda question. I'm happy to talk about how it's applied, but or how.
Yes, sounds good. Sounds like a plan. So, Mothering from the Inside Out was designed specifically for mothers, and we now talk about caregivers, parents of all kinds, right? Specifically for those in recovery. It is designed to be delivered as an individual parenting psychotherapy, which is kind of a funny combination of words. We talk about something, things called parenting interventions. I don't know how much I love that. Or parenting supports. I think it's a little more robust than that. But parenting psychotherapy, really getting into deep conversations around what's easy and hard and joyful and challenging about being a parent. And its main treatment target, the main thing that we're hoping to move the spectrum on, is something called parental reflective functioning, or parental mentalization. And how we define that is really a caregiver's ability to see through the eyes of their child, a parent's ability to look at their child's behavior and understand it and make sense of it in terms of the child's underlying mental states. And by that, we mean thoughts, emotions, wishes, desires, intentions, all of the things that go on in a child's mind. And we see that when parents are better able to see through the eyes of their child, better understand their children's mind, they're able to respond a lot more sensitively based on the child's kind of attachment needs. And that leads to really nice outcomes. And the other piece of parental reflective functioning is not just understanding the child's behavior in terms of underlying mental states, but also one's own behaviors as a parent in terms of underlying mental states. So understanding, wait, why do I feel pulled to do the thing that I feel pulled to do? And is this a response to something in the here and now, or is this a response to someone else, someone else that is either really, is it helpful? I mean, if so, maybe it's really a helpful thing for my child, but sometimes it's not. And sometimes it just takes a conversation, a thought partner to really parse that out. And that's where mothering from the inside out really shines in those conversations that help tease those things apart.
And so I know a little bit about the model and a little bit about this work. So, I think that one of the things that I think would be really helpful for folks listening to hear a little bit about is kind of what are the things that make parenting challenging while you're in either active addiction, recovery, working towards recovery, anywhere on that spectrum, because often there's a lot of shame inherent in addiction in general. And then there's a lot of layered shame in the context of having difficulties being there for your children. And I think some of the things that are really helpful that I know you both know a lot about is helping parents understand why that's hard, and so that they can approach that differently and hopefully with a little less shame. Is there anything that you could expand on for that?
I'll let you go, Lili.
Yeah, I'll take a turn. And you as the psychologist, correct me, because I'm just a pediatrician over here. Not in the, not a neuroscientist over here. But I'll say it that when you were speaking, Lisa, that what it made me think about was a lot of what we talk about in one of our Mothering from the Inside Out training is around how like the intersection of addiction and parenting within our minds, within our physiology, within our brains. And so I think about, the development of addiction is often a coping mechanism for managing hard emotions, hard feelings. It can be developed as a strategy. Unfortunately, what that can lead to is when we are dealing with hard emotions by kind of encouraging with substances that make us feel good, right? Like, and intensely good, above and beyond anything that we can find in sort of more natural pleasure. We change the way that our brain receives that dopamine, those neurotransmitters that make us feel good, right? And so it's a little bit of a rewiring. And so then when we're used to kind of this high level of pleasure, other things can feel less pleasureful and in fact more stressful. Sometimes you can actually shift that stress reward balance. So when you bring parenting into the picture, a lot of what drives our parenting behaviors is that reward circuitry of the brain. So it's very stressful to have that baby crying, but if I'm able to calm them and soothe them, that gives me the boost of like, oh, that feels so good. I'm a competent, parent. I was able to do this thing. I want to do it again. And that, as Nancy, our late mentor, used to say, like those pathways are on traveling on the same highway. There's not a difference, right? Like our brain doesn't know the difference between the pleasure from parenting and the pleasure from substances. And so it can cause some challenges where what we talk about is kind of a high stress, low reward environment for parenting, which can be super challenging because you really want the opposite, right? You want to try to calm the stressors and increase the pleasure and reward from that parent-child relationship. I think that's everything I wanted to say about that. Amanda, anything you would want to add to it?
Oh, the thing that I mean, yes, that completely. I think that imbalance of reward and stress, and so that's the long and short of it. And the thing that I'll add to it is what we imagine mothering from the inside out as doing is working to tip some of those scales, to increase the reward of parenting. Parenting's a lot more enjoyable if we can look at our children and say, oh, something's going on here. Let me help remedy that. And it feels really good. And have that actually have a synergistic effect for recovery. There was an old school of thought that was really around, a parent is struggling, so let's send them to go get sober, and then they can, do some parenting classes. And really, what we're imagining is doing them at the same time for synergistic effects, because making parenting feel really good and enjoyable can really help recovery, the same way that recovery really helps parenting be more possible too.
I love that. I love that analogy there, and thank you both for this awesome, impactful work that you're doing. Took a ton of notes, and I love the research of this. Parenting psychotherapy is just such a positive tone versus intervention, like you said, Amanda. And certainly there's a yin and yang to it. I loved what you said, Lili, about the the pleasure pathways. They're traveling on the same highway, and to get to that point for somebody in recovery, early recovery, or maintenance recovery, or anywhere in between, to have that pleasure from their children, really, there's those of us that are parents, there's nothing else like it, where you're layering in your experience with life experience into another human to help guide their life. And as we were preparing for this podcast, and as I was doing my research on your websites, and just looking at this, I was just thinking, like, what better way in recovery to really practice these principles than in parenting? And for those that are listening that maybe are in recovery, or maybe caretakers, I thought that was great. I think, Amanda, you said that it started off as mothering and then really just expanded to caretakers of those in recovery, because we all know people who for a multitude of reasons are taking care of children who they did not give birth to, or are not theirs biologically, but through loving, caring, motivation, are there to be that caretaker, and that's great. I'm just wondering, for whether it's biological or caretakers, what are some ways that we can begin to strengthen the attachment with the children? What are some practical tips or tools if someone looks at this podcast here when it's out and says, "Oh, I want to learn about that"? What would you say to them? To either one that would like that.
I'll go next, but definitely want to hear what Amanda would have to say. I think maybe what I learned the most from mothering from the inside out, and I'll just say this: like, none of this was part of my original training. Like, I had to learn this well after becoming, going through my formal training, and I had to, I think, Lisa, you mentioned, like, we all carry lived experience of different kinds, so I think part of what helps me stay in the work too is, like, my own experience applying this to my life. So I'll speak a little bit from, like, my own perspective of this, Jesse, which is that I think in order to provide the relationship and experience that we want for our children, we have to give ourselves that first. And that's why we talk about mothering from the inside out, right? So much of what I do in pediatrics, and so much of the way our systems are built, shine the light on the child. And this is what we've been really trying to change. Is like, oh, the child has this behavioral problem, bring them in to see the psychologist, right? And we have a hard time shining the light on ourselves. But it's not, I don't mean shining the light in a sense of blame. I mean it as, like, if we've never experienced somebody holding us in this way, thinking about us in this way, what's being curious about what's going on in our minds and our thoughts and feelings. It's really hard to do that for our kids. And we talk a lot in the world of infant mental health. This is not an analogy we made up by any means, but it's about like, and I'm sure it's true, applies to recovery too. It's like, you got to put your oxygen mask on first. And so I think that was the biggest thing is like, I think as a pediatrician, I was so focused on like, what do I need to do for my child? How do I need to breastfeed? How do I need to sleep train? What educational toys? Like, that's how I was thinking about development. And this paradigm has really shifted it. It's like, holy smokes, like I wasn't taking care of myself. I wasn't thinking about my own emotional needs. And, for me if I can speak again about my own experience, like I really struggled with postpartum depression at the time and didn't even realize it and didn't even know because I was so blind to my own internal world. So I'll stop there, but that's what I would say it's maybe not an easy to do, but it's like definitely the biggest lesson learned that I've had from the work.
Thank you.
Thank you for sharing that, Lili. I always love when you talk about, your job as a mom too. And it's been, beautiful to kind of see you chew on these ideas from that perspective. And from my perspective as somebody who sits directly in the room with moms giving or caregivers of any kind, right? As the person who gives that oxygen mask, it's the most rewarding thing I do. And the practical advice, I don't know if it's practical advice. It would be find ways to get that oxygen mask, right? And that might be in community. It might be with peers. It might be with other family members. The challenging part is that so many families in our world, especially those in recovery who have experienced addiction, is that sometimes family is not the safest group of people to turn to, and might in fact not have been able to successfully hold us in mind or understand us as people with minds. And it's really hard to understand our children as having minds of their own with their own little nuances if nobody really ever gave that to us. Right. So I'm just paraphrasing what Lili said. I'm paraphrasing a favorite quote that I quote every time I'm talking to anybody, that understanding of minds is hard without the experience of being understood as a person with a mind. So the advice is find somebody who can offer that to you. And sometimes it's family, sometimes it's really not, and that's okay. Sometimes it's supports, sometimes it's a substance use counselor. Sometimes it's finding somebody who really does the parenting work. We're all over in pockets. So finding that person, I think, is the most critical step because it just cracks open the space to be able to do it for someone else.
Yeah. And Amanda, I guess what I'll just highlight just a teensy bit more just to say it's not selfish. I think a lot of parents think me taking this time for myself to focus on myself is selfish. I need to be this selfless parent. And in fact, when you're running on empty, you can't be the parent you want to be.
That's why I love that analogy. I use it often as well with the air mask because there's so much focus, whether it's a child or somebody in recovery or just in general in life, you want to help this person. And it's like, how much do I have in my tank?
Yes.
How much am I being pulled in multiple different directions so that then it becomes overwhelming and that pleasure pathway that we speak of often in this work, we go to something that we know is going to give a larger hit of pleasure. And usually that's not something healthy because we want that instant gratification.
Yeah. Yeah. Or our brains know that will work. Right. So it's hard to build those new pathways. It takes a long time, right? To stop walking down the same well-worn path you've been walking down for a really long time and start to develop a new path, right? Just even having this information, it takes a lot of practice. So I assume that's really inherent in the work is that kind of keep coming back to it and The other thing that just really strikes me as part of this conversation is really the capacity for this kind of work to break really intergenerational trauma cycles. Right? So this probably didn't start with the parent that we're working with. It started with their parent and their parent. And we know from having done this work for a long time, I treat a lot of families. I treat a lot of generational families in our programs. And that really kind of ability to start, well, let's start to try to do something different. And that ripple effect of what that looks like for kids is got to be huge, so that we're not just repeating the same cycles. And I also love that perspective of, we are constantly in need of evolving as a field in addiction. And I love that you reference kind of that old thinking about, well, let's send the parent over here and tell them that they need to go handle their stuff first, and then they can come back and try to be a parent. But what that really does is create separation at really critical times in the development of that child, instead of finding ways, even small ways, even if you don't, so to anyone listening or who's been through this path, even if you don't have your children with you full time, right? So maybe there's child welfare involvement, maybe there's other families supporting, there's some other arrangement. How can we create this space for attachment in the ways that we can, wherever that parent is at right now?
Yeah. Lisa, can I mean, beautifully said. I don't, I just even want to listen to that again when this comes out. But I'll just wanted to highlight one other thing about what you had said that popped up in my mind was creating that space. And this maybe goes back to the question about tips. I think the other thing we really wish was on a billboard or a soapbox, I think we repeat a lot, is just it's not about a knowledge gap. It's not just oh, go to this parenting class and learn, let's send you away, right? You handle your stuff, you get sober, and then now let's go to this parenting class and we'll teach you how to be a parent. I can't tell you how many times people are what do you teach people in Mothering from the Inside Out? I'm we don't teach. We help people rediscover what's already within them and tap into what these new pathways of, we're saying, pleasure and pride and confidence and reward, and have an experience and build their own, reserves and capital. So I wanted to just say that in this space that, this new visionary space that we would love to create for parents in recovery. I think that's one of the key takeaways too.
And it sends the message that you're not doing anything wrong.
Yes.
Right? You're not you just don't know what to do and you're doing it wrong, right? It's really about kind of really supporting the parent. That's why I love the title Mothering from the Inside Out, so that they can have a different experience and therefore the child can have a different experience.
100%. I think, I really believe in kind of a fundamental at its core way, that's one of the things that maybe distinguishes Mothering from the Inside Out from some other practices. There's many others that take this stance as well, but I'll just bring in kind of the concept of intersectionality here as well, which is to say that for some substance use, especially, it may affect minoritized communities more than others. And we know certainly poverty and trauma does historically. And so it's really important for us to feel not only at this historical kind of racism level, did we impart the trauma and now we're going to tell you what you're doing wrong because of the trauma we imparted and how to do it right. I think that's really a piece of this as well, is it was always there, the knowledge, the love for parenting, for leading a healthy life was always there. And it's about kind of restoring that rather than, and I'll say this, a lot of our clinicians and counselors are white people, working maybe with people of color. And it's not like, oh, and the world of child psychology is mostly, white people. So it's not like, oh, we have all this science, like now we can teach you how to do it right. Like, no, it's like, we're going back to our roots.
I really appreciate that. And I think it's important to recognize. So I think that we really need to understand that and apply it to how we interact with parents and those working towards recovery. And even in some of the things that I think we struggle with, even in addiction treatment, right? We know very clearly that the rates of overdose have dropped, but they're not dropping for all communities, right? So that tells us something really clearly in this space, is that there's not a lot of trust and connection that bring people even into our spaces. And so how do we change that? And I think that's something we all need to recognize and think a little bit more about. What can we be doing differently?
I really appreciate that point, and something that Lili can speak to this as well, but as a professional kind of having to navigate systems that are not always very trustworthy to myself, let alone anybody who is carrying lived experiences or relying on systems to be helpful. Something that Lili and I have thought a lot about is how the same way that we hope that parents can return to a sensitive, thoughtful, compassionate way of being with their children ought to be mirrored in the same way that we interact with families, and that our systems hold us as professionals as well. So I appreciate you saying that. Like, it's the job of our systems to be thoughtful about how they can be trustworthy rather than just assuming that they are worthy of trust because by nature of like being a system. That has not always been helpful.
Right. And it puts the difference in the person being an expert in their own life instead of applied expertise, right, from some outside system. And that's something that I think we're starting to see, and we need to see more of, even in ways that we are implementing lived experience in our programs by adding recovery coaches in our opioid treatment programs to work alongside individuals instead of just, I'm a therapist, right? Like, I think therapy is great. I think everybody should be in therapy. And like, it's not the answer for everybody in every moment and in every situation. And so how can we create systems that are more supportive, right? Not just to the person, but to the whole family. We've been doing some work, as you know, we have a presence in where you are, Lili, in Western Mass and the Berkshires. And we've done a lot of work of trying to challenge those systems differently, right? Like working with child welfare differently and really starting to do some more education and do some more different ways of communicating as a treatment provider, even with the child welfare system, so that we can be part of that connection and part of that evolution.
Yeah. And I'm just reflecting here. There's so much, and I wish we had like a 3-hour podcast to go over all this. But we're speaking of a lot of the problem, right? The misplaced trust, the broken systems. I think of my own lived experience as an adolescent with child welfare services and how that made me feel. And there were and not to paint with the broad brush either. There were those that I came into contact with that I could tell deeply cared and advocated, and I felt that even when I was going through a lot of challenges that prevented me from really connecting with people. And then there were the times that was just flat out, like I think back to one where it's just like, wow, I can't imagine doing that today. This was 25 years ago, and that was the old school way of thinking that we talk about. So I'm just wondering, if we had like kind of like the miracle question, unlimited budget, unlimited time, what would the ideal system of care look like for something like mothering from the inside out, so that in all reality, maybe we won't get there 100%, but something that we can work toward or aim for, or anything that's going on in the program, like the next step. Just wonder if there was anything like that.
My gosh, I love this question so much.
Awesome.
Because I feel like, I don't know. I mean, Amanda and I dream about this quite a bit together, and with our partners in this work as well. I think well, and I guess I'll just say, like, I know other people are wondering about this too. Like, how do we get these more tailored supports that get at root of problems rather than trying to pave over them into the hands of the families and people who desire this experience. And so I will say that, actually, maybe just very briefly, echoing what you said, Lisa, like, Mothering from the Inside Out started as this parenting psychotherapy one-on-one. And we have continued to explore and get curious about how it could look differently. So we have taken it in all kinds of different directions and learning in the process. We've taken it into home visiting, where whole families are involved in this type of work. We are now in the process of developing a tailored training program for people with lived experience and recovery support staffs who are not clinicians, because the original training is really clinically focused for therapists and counselors. And so we're making one of our big goals is, how do we take these psychotherapy concepts and make them just more available to anybody who wants to apply them to their work. And as I know, you've had Jess Griffin on this show, and she always says, you don't have to be a therapist to be therapeutic. So, like, that kind of thing. But beyond that, probably where we geek out the most is, how do we create reflective programs? And so actually, Amanda and I are kicking off a new training in April called Mirror, which is designed to help create reflective programs. And so I think, Jesse, that would be my dream, is like, how do we take this from the responsibility of the clinician counselor in that one-on-one delivery of a service, and make it everybody's responsibility to be reflective for each other within our teams across different hierarchies of leadership, and also to really hold the families in this way to, like, not just an oxygen mask, but like that whole wraparound bubble for families and communities.
That's kind of that parallel of, instead of just delivering kind of trauma treatment, but being a whole trauma-informed system, right? So it's like taking these concepts and spreading them out across systems, and our systems need it, right? So in things about, like, how do we provide access when somebody is in inpatient substance use treatment? How do we structure that session? How do we help people increase those connections? How do we change our systems and make space for how we allow people to talk to their children while they're in care, right? Like, how do we create those spaces, and where are the places we can do that? I know our peer recovery support centers, particularly Everyday Miracles in Worcester, does a lot of this work of, like, actually creating a space in the center for child visits, right? So that the parent feels like they're already in a safe space, like they're already among their community that is supportive of their recovery. And so they can bring that into their interactions with their children, because they're not in some foreign space or some space where they feel like they have no agency, or they're kind of already in a different space. And we do a lot of work with the Miracle Mamas. I know those folks as well. We've had them on the podcast as well, Kristen Puccio and Carrie McCollum, and really just kind of, how can we keep bridging across things instead of doing things separately in silos? Like, how can we connect systems differently? So I really love that perspective. I think this will be a good way to transition before we end with, like, what are we doing now? So, kind of, if Lili, maybe we could talk a little bit about the current research project that we're doing, and that opens up a window for us to have you all back maybe after that, right? And we can talk about what that looks like. So do you want to talk a little bit about the work that Spectrum is doing with you now?
Absolutely. So we have just been thrilled to be partnering with Spectrum on this opportunity well, for one, I guess I'll just say bring mothering from the inside out to Massachusetts, but really beyond that, bring it out of a research setting and into practice. So it was, as we mentioned, Nancy Suckman, our late mentor, she developed it, designed it, and tested it, did several clinical trials in Connecticut, in the New Haven area, and showed that it did have an impact both on parent-child relationships, improving parent-child relationships and interactions, and also on reducing depressive symptoms and relapse. That's in a research setting. So what we've done with the most recent collaboration with Spectrum and Behavioral Health Network here in the Springfield Holyoke area is ask the question of like, okay, great, but like, how do we get this out to people in the real world? So we have a 5-year grant from the National Institutes of Health, National Institute on Drug Abuse, to study just that. So we have since last year being 2024 into 2025, began training counselors, substance use disorder treatment counselors at Spectrum and also at Behavioral Health Network to deliver mothering from the inside out as part of their program. But I think what's been really important is the leadership at Spectrum has been helping us think like, great, like we know your counselors are stellar. They're amazing. They can do the thing. But how do we make this work within the current environment, the funding schemes, the demands on caseload, and then also like a big question that we've been answering is how do we get this approach that has been designed for parents, and how do we find those parents within the overall client population of Spectrum? So how do we take something that's specialized and connect it to the person that needs it within this large system and setting? That's, I guess, where we're at. We just kicked off the trial in December, so we're in the early days of it. We'll have another 2.5 years of recruitment of these moms and continue to work with the counselors. And then at the end of the day, what our hope is that we'll be able to take what we've learned from this experience and have sort of a toolkit so that if an organization out in Colorado, Nevada, wherever, Texas wants to do this, that they'll really have learned from you all on what helps make it work at the systems level and what helps make it work all the way down to the parent participant level.
I love that. And we love being part of that implementation science because research is great and it gives evidence-based practices, but that doesn't always translate to the real world. And so this is what kind of implementation science can do, is start to think about how do we take this evidence and then actually use it, right? Because it's not helpful in a study that gets documented on a paper and never goes anywhere, right? It doesn't have any real impact. And even just thinking through, and obviously I've been a big part of this conversation with you all and how we do this at Spectrum, like how do we even identify parents? Like, and how do we as a system think differently about treating our patients, which are often very much an individualized approach as parents, and seeing them in that window? Like we ask at admission on a biopsychosocial, right? Like, how many children you have and how old are they and what does that situation look like? But do we have that conversation again? And is it documented somewhere in the record? And so it's like that's kind of one of the system challenges that I think is inherent in the way that addiction treatment is delivered on a very individual, non-system basis, right? That I think we have opportunity to learn from just by taking part. Is there anything that we didn't talk about that we should? I mean, we could have whole long conversations, and I'm sure Jesse agrees with me. We'd love to have you back either in the midst of this research or at the end or both. But anything that we did not talk about that you would like to get out there?
Amanda, I want to give you an opportunity if there's anything on your mind.
I don't think so. Should there be?
No, I've been talking a lot. So I just wanted to give you
No. It's just, it's what Lili said. We dream a lot about this work. We wouldn't be here if it weren't for collaborators in our community, collaborators in our larger team. We are held by a small but mighty group that all makes the work possible. And yeah. We're really excited to be collaborating.
Awesome.
We're really excited to have you on.
Well, this conversation has been so personally benefiting, and I know the people that are listening now and will listen to this will get something from this as well. If anyone is interested, if anyone is, a mother or a caregiver out there and listening and saying, hey, how do I get involved, or how do I reach out? What's the best contact method?
Question. I think, certainly we'd love to share. Our website is motheringfromtheinsideout.org. There's a lot of information there. I think we only have a button for referrals on training, actually. But if you're a parent, I'll circle back to that and see, do we have some contact connection for parents? What I'll say is we're very available. It's just, we love hearing from folks who are interested. We'll bend over backwards. We have a sort of directory of folks we've trained in the state. We're very fortunate. I'll just say that for the most part, most people trained in Mothering from the Inside Out are here in Massachusetts, thanks to funding from the Departments of Public Health. It's hard to get outside of the state. There's just a handful. So we're small, we know most of them, and we'd love to help connect anybody who's interested.
That's so great, right? And when we are, actively recruiting parents. So if there's opportunity and you are local, I know we have a broad reach sometimes on this podcast. We also have a fair amount of local folks listening. You can reach out to Spectrum, to BHN, and think, if you're a parent, and think about how you could get connected to this support. And I think a great way to end this episode, and Amanda, what you said about your small and mighty team, we've definitely said this quote before on the podcast, but it just is so, I think, clearly at work here in the work that you are all doing, is Margaret Mead's quote, right? Never a doubt that a small group of thoughtful, committed citizens can change the world. Indeed, it's the only thing that ever has. So keep doing what you're doing. We are grateful for it. We appreciate you being here and spreading the message, and for all of our work together now and in the future.
Likewise, we this is what makes it worth it, is getting to meet wonderful and passionate people like you all, and to be in the work with you. So I hope we will have another conversation sometime down the road.
Thanks everybody for listening to this episode of Airing Addiction. Jesse, do you want to remind folks what they can do if they want to keep listening to us?
Like, subscribe everywhere you listen to podcasts. Come on back next month for another awesome episode. Thank you both, Amanda and Lili, today.
Thank you.
Thank you for having us.
Thanks, everyone. Bye now.